Hi. In this video, I'm going to be reviewing how to document on the progress note, specifically in the assessment and treatment section. Please note that this video is recorded in a completely fake training database. So therefore, things will look a little bit different than in your real live database, such as colors or maybe different items that are listed within the progress note. Let's get started. I'm currently logged in as a provider on my office visit screen. You can see the number 1 in my S jelly bean letting me know that I have one patient that is currently marked arrived. From my progress note, I can see that this is the patient marked arrived based upon the visit status. I can tell what room my patient is in as well as their current status, meaning ready for provider. I'm going to select my patient's name and it's going to take me directly to my progress note. At the very top, I have my patient dashboard. On the right-hand side, I have my right chart panel, and then over here I have my progress note. Now, realistically, my medical assistant has already filled out all this information for me, but for training purposes, we are looking at a blank progress note. I'm going to go ahead and click on my orange assessment link, and this is going to take me to my assessment window. On the left-hand side, I have my floating toolbar, and then looking at my window, I am currently on what is called the classic search. Now you can search for an assessment from two different views, one being the classic search that we are currently on, where on this left-hand side, you would have what is called your assessment tree. This makes it a lot easier for you to find your diagnosis codes. You could select a category from your assessment tree, and then within that category, you would see your different assessments associated over here. Now, because I'm in my fake database, I don't have that nice assessment tree like you're accustomed to looking at in your real database. I can still search for my assessment here. So let's say I want to search for something with the word pregnancy, and it's going to start filtering my codes for me here. A couple different options. I can click this arrow over here to go to the next page. If I have anything in my favorites list, that's where this star comes into play. I can search by previous diagnoses or my problem list. Once you make a selection, it's going to drop down here underneath selected assessments. Now, the very first assessment that you enter in for your patient is going to have a check mark next to it, signifying that it is the primary diagnosis. You have this PL column that stands for problem list. So if you wanted to add this assessment in, you could simply check this box and it would now be added into your problem list. Any notes that you might want to enter in, you can add by clicking on this box over here on the right-hand side, and it's going to bring up a pop-up window. You can choose things like adding a risk, you can specify items here, or you can add notes in here. Once you click the close button at the bottom right-hand corner, you'll see any information added in here. The X on this right-hand side is going to clear any of those notes or risk that might have been added in. Your trash can icon is going to completely delete the assessment from your progress note. And then your star icon would add it into your favorites if you chose to. So I'm going to just go ahead and delete this assessment. And now it's been removed. My other option is to search in what we call a smart search. So over here on this right-hand side, I'm going to click on my settings gear icon, and I'm going to check the box next to smart search. I already have my box checked for auto map to ICD-10. Notice once I clicked that, my tree on that left-hand side disappeared, and now I can tell by the center of my screen that I'm searching for my ICDs through Smart Search. I can begin searching for my assessment here, just like as I did before. So let's say my patient is here for pelvic pain. Notice some of my assessments are in blue. Once you click on an assessment in blue, it's going to take you to what's called your advanced ICD-10 search window. It wants you to choose a more specific code. I can make my selection, and then it's going to give me the exact code down here at the bottom that I need. Once I select my code, it might also have a manifestation code associated with it. So I'll get this pop-up window and it's telling me that it also wants to add this code. I can click my OK button, and now I have just added both of those assessments down here at the bottom. I still have the one marked here on the left-hand side for the primary. If I wanted to switch it to a different one, I can just simply check that box. To add it into my problem list, I can check the box in that PL column. And then I can always uncheck it if I decide I don't want it added into my problem list. Now, if I wanted to add an assessment into my problem list that I am not treating my patient for today, but I still want it to be documented in their chart, I can click directly on this button problem list over here in the center right-hand side of my window. This is going to show me any problems that are already added to the list. I can always manually add one in the top right-hand corner, clicking on Add ICD, and then I can search for my assessment here. I can remove an assessment. I would need to select it on the far left-hand side and then click my remove button over here in the top right. And then you also have a couple of other features like copy to medical history. If your patient did not have any problems, you could document that in this window by checking this box, No Known Problems, in the center of your screen. Once you have all of your problems added in, you can also add different things in, like you can specify reasons, you can put in a note, you can add in a risk, you can change the status here, etc. And you can also tell when it was added, who it was modified by, in different items of that sort. I can hit my OK button down here at the bottom right, and it's going to return me back to my assessment window. Now I'm going to just go ahead for training purposes and add in a couple more assessments. And they're going to drop down here in this bottom window. Once I hit the X in the top right-hand corner, it's going to populate onto my progress note. The very first one listed is always going to be your primary, but you do have the option to rearrange if you would like. So for example, if I wanted my mammogram to be the next one in my list, I can always click back on my assessment link and I can drag and drop. So I'm going to hold down my mouse to just drag this assessment up, and then I'll let go to drop it. Now, once I close out of my window in the top right-hand corner, my assessments have been rearranged for me. All right, so let's go ahead and navigate over to our treatment window. This is where we order all things for our patient. I'm going to go ahead and click on my orange treatment link, and it's going to bring me into that window. On the left-hand side, I still have my floating toolbars that follows me through the different windows throughout the system. I can see here in orange a list of all of my assessments for my patient. Notice they have some different icons over to the right. Your first one stands for order set. The middle one is eClinicalWorks. And then the one all the way to the right is where you can add notes in for that specific assessment. So I can click on that notes icon, and at the top I have the option to add some notes here, and at the bottom I can add some internal clinical notes. Once I close out of my window, I will see those now listed underneath the appropriate assessment. Now, a couple different things I can do from here. In this top left-hand corner, I have the option to add in a diagnosis. Maybe if I forgot one on my other window, I can always do so from here as well. I have my column to see my previous diagnoses, my problem list, or I can simply search for a new one. My RX icon, this is where I can add in a new medication for my patient, or I can refill a current medication. I do have a button specifically for current RX right here, but I can always get to it from this RX tab as well. So I'm going to go ahead and click on my RX tab. And I want to point out in the top right hand corner of my window, I am underneath the tab Add New RX. The first thing I want to do is make sure that I have the appropriate assessment selected. So on the left-hand side, I have a check mark next to my assessment, and this is the one that I want to use. So I can then just begin searching for my medication here. A couple different icons that I have. My star icon is going to represent any favorites that I have already saved under my profile. And then my next icon is my filter. So this depends on how I'm searching for my medications. Notice here at the top, I have Enable Enhanced Medication Search. If I put a check mark here, it's going to select all of these different items for me so that while I'm searching for my medication, I'm searching through all of these different things. If I'm not sure what something is, for example, what is a fuzzy search? I can always hover to discover over this I, and I can see that it is going to search for medications that I may have misspelled by a couple characters, that it would still search for those. And then it gives me that example. I have my RX type set for Medispan, so I know that I'm searching through that Medispan database. I can choose if I want to search under starts with or contains, as well as how I want to see my dosages. So if I have just standard selected, it will not show my favorites list, or I can choose to only show my favorites, or like mine is listed, I would see both my favorites and just medications listed. So now that I have my preferences set, I can go ahead and search for a medication. So I'm going to start my patient on naproxen. Notice once I start typing, it starts filtering it out for me, and I can select the appropriate medication. On the far left-hand side, you have this red D for your dosage calculator. You have this pencil icon so you can go in and edit your medication before selecting it, which I would recommend doing. Notice that your refill column here is blank. We do need something added in order to send that medication electronically. So I'm going to go ahead and click on that pencil icon. And I'm going to work my screen left to right, making sure that I have the appropriate selections made. I can choose from this box up here at the top, or I can always free text here in this box listed. So I'm not going to add any refills on. I'm going to select my 0 here. I can also see where I can read my prescription in full listed here in the center of the screen. And I can add this to my favorites. So if this is a medication that I prescribe frequently, I can go ahead and click this add to favorites button, and it's going to bring it up for me one more time that I can choose to make sure my directions are correct. I have my NDC code selected, so now I can hit that OK button, and I just added this into my favorites. I can add any notes to a pharmacy from here, make any changes if I need to. If I'm good to go, I can go ahead and click my OK button at the bottom right, and it's going to drop down here under selected medicines. Now, if this is the only medication that I'm prescribing and I wanted to go ahead and send it over to the pharmacy, anywhere that you see the send button, this is going to take you to what is called the common send screen. I can click this arrow next to it and choose specifically if I want to e-prescribe, print, or fax. Or when I just click directly on this send button, I can also make those selections from here. Now, due to being in my fake test database, it is not going to let me send this medication, but I'm going to show you what this screen looks like using the example of print. Now, realistically, this would be listed as ERX, meaning I want to e-prescribe this over. But notice once I did switch that, all the way to the right, I have my red exclamation point, letting me know that there is some kind of problem here. I can hover to discover to find out what that issue is, make my corrections, and then I would be ready to send. In this instance, it's because I'm in a fake database. So I'm going to just switch my mode back to print so we can see realistically what it should look like. From here, I can see my prescription. To the right, I have my pharmacy. If I needed to go in and change it, I could always do so by making a selection here and switching to a different pharmacy. I would see any notes listed here, and then on the far right-hand side, I would have my status. So as long as we have that green check mark, I'm good to go to hit my send button at the bottom right-hand corner, and it would send it over to the pharmacy. In this instance, I'm going to just hit my X at the top right to take me back to my Manage Orders window. Now that I've added in a new medication, I also maybe want to refill a medication for my patient. In the top right-hand corner, I can just simply toggle over to this Medication Summary tab. This is where all refills will take place. On the left-hand side, I still have all of my assessments listed. I don't have to link an assessment to my medication if I don't want, though. I can always use this other option here. And then you have a few different options listed here. So I can see the medications my patient is currently taking right now. This is that naproxen I just added in. I can always hit the plus sign underneath here to see any other medications that might be associated to a different date. So, for example, on April 19th, my patient was started on Cipro, and I would be able to see any other ones listed here. So, let's say, for example, I want to refill this ortho tricycline low. I have a C to continue, an R to refill exactly as it's written right now, meaning I would have this 28 days, number 3 refills, etc. So exactly as it's written. The 30 would refill it automatically for 30 days, the 90 for 90 days, or an S to stop the medication. Your orange H is going to represent the history of the medication. So let's say I want to refill it exactly as is. I like that it's a 28-day prescription. I like that I have 3 refills on it. I'm going to just simply click the letter R and it's going to drop it down here at the bottom for me where I can see that medication listed here. I can click my OK button at the bottom right, and the medications will add to my treatment window. But if I have any kind of drug interaction, I'm going to get this pop up window here where I can take a peek at this. And then if I'm good with my medications, I can hit the OK button at the bottom right. Now that I'm back on my treatment window, I can see my medication underneath the assessment that I linked it to. If I needed to go in and make any changes, I could always click directly on the medication and it's going to bring up that RX edit window that I want to work left to right. As mentioned, anywhere that you see this send button, this is going to take you to that common send window. So I could have always accessed it from right here from my treatment window instead of in my medication window. And it's going to take me to the exact same window that I was already in. Now, a couple other things I want to add for my patient. Let's say I want to order some labs. In the top left-hand corner, I can click on the word labs, and it's going to take me to that manage orders window. Notice in the top right of my screen, I'm under the tab add new order. So I just went from add new RX, medication summary, to now add new order. So very quick way that you can toggle between the windows without having to close in and out so much. Now, the first thing I always want to do is make sure that I have the appropriate assessment is selected over here on the left-hand side. In this instance, I do, so I'm ready to start searching for my lab. So let's say I want to search for a thyroid panel. I can start typing in the word thyroid, and it's going to bring up everything that contains that word for me based upon my selection here of contains. I can select my lab and it's going to go over to my today's orders in this top right hand corner. Now, I have a few different ways that I can make my selection. I can search for it like I just did, or if I have a favorites list, anywhere you see a star, that's what that's going to represent is a favorites. So this is showing all my favorite labs that I have added in. I can also search by previous orders. This is going to show me everything that has previously been ordered for my patient. And then you also have your lab company. So again, I am in a test database, so please keep in mind my settings are a little bit different than what yours realistically look like. But you want to make sure that your lab company is set to Copia or whoever the preferred company is, and that you're making the appropriate selection. Now, let's say I also want to order a diagnostic image for my patient. I don't have to close out of this window. In the top left-hand corner, I'm just going to navigate over to this DI tab. Notice my window looks the exact same. So if you can order a lab, you can order diagnostic imaging. Always remember to switch your assessment first and then go ahead and place your order. So I can start searching for everything with the word mammo. Notice here my filter says starts with instead of contains. This is a personal preference how you would like to search. You do have this little settings gear icon up here in the top right, and this is on every page, lab, DI, and procedure, that you can click on and make your default lookup settings here. So if I want mine to default always be under contains, I can click OK, and now this will default be listed here for me. And there's also some other settings in there you can set, like your default company or your default favorites, etc. I'm going to go ahead and click on my mammogram test here. And then it's going to drop it up here in this top right hand corner under those today's orders. Once I click my close button at the bottom right, it's now going to be listed here on my treatment window. If I needed to navigate back to that common send window, I can always click on my send button down here at the bottom right, and I would be able to move forward with anything in this window, such as transmitting my labs, printing out my diagnostic image, sending any prescriptions, anything that I would need to do, I would be able to do so from this window. That concludes our video on how to order an assessment as well as put items in your treatment window. Thank you for joining.